Welcome back. We've all experienced wounds of some kind. Most of the time, they heal on their own. But sometimes a wound needs additional medical attention. At Daviess Community Hospital, they offer treatment for chronic wounds and continued care for patients. The Wound Care Clinic at Daviess Community Hospital provides a variety of service to patients dealing with chronic wounds or those that won't heal.
Typically, after a wound starts and has been around for about 3 or 4 weeks and is just not healing, that would be the time to see the wound care team here. If a wound is not healed in the first 3 to 4 weeks, then it becomes a chronic wound, and things need to be done to change it into a more of an acute wound so that it does have the opportunity to heal.
Dr. Gilbert Field is one of the newest members of the wound care team. He brings a vast knowledge from more than 2 decades of surgery experience, including serving in the military.
I've been involved in all facets of general surgery, including trauma, but also outpatient surgery, and then for the last 6 years, wound care. Acute wound care through my entire career, doing surgical wounds and trauma wounds, etc. Complex surgical wounds are sometimes difficult to heal. But chronic wound care is different. It involves more of the care of diabetic patients, diabetic foot ulcers, venous stasis ulcers, and such.
He came to Daviess Community Hospital temporarily, but found after being there, the hospital, the staff, and the surrounding area was a good fit.
Working as a surgeon for over 20 years now. I've been in Indiana since 2005. I really like working in southern Indiana. I like the weather. It's much better than Michigan, where I'm from. And the people here in Daviess County and the surrounding community are great people.
One of the biggest challenges with patients is getting them to recognize the need to seek help.
Once they're involved in the wound care team, they have a tendency to know what to look for. So they no longer wait as long as they would in the past, because they know if they get in sooner, we'll be able to heal them quicker and they can get back to doing their normal activities. But in general, yes, patients wait way too long, sometimes months and months, and then it makes it a challenge to get those wounds to heal.
Sometimes it's not initial treatment, but continued care that's needed, like, for example, burns.
Most minor burns, like sunburns or kitchen-type burns, will heal on their own in a matter of 3 to 4 weeks anyways. Those that are burned extensively or have to go to the emergency room for initial burn care or to a burn unit, then can do their follow-up care here in the wound care center, and we can take care of their dressing changes and so forth.
If you think you have a wound that needs attention and treatment, the best thing to do is simply call the Daviess Community Hospital Wound Care Center.
Staff here can discuss it with them and see if they would be an appropriate patient to come see us. But I think the first thing is talk with your primary care provider and see what their thoughts are.
You can follow Daviess Community Hospital on Facebook. They're very active there at facebook.com/Daviess Community Hospital, where you can find additional information not only about the Wound Care Center, but services offered there.